Hello, and thank you for joining me on the Dr. Suzette Glasner Podcast. Don't forget to hit like and subscribe if you want to continue to learn from me. As an addiction specialized psychologist, I often get asked the question, how do I know if my friend or my loved one or my family member is developing an addiction to something or maybe already addicted to something? So today, I'm going to focus on 3 telltale signs that someone you love or care about may be forming an addiction to something or maybe already at that point where they need treatment or intervention to address it. The first sign is what we call tolerance. A person seems to be able to consume more of a substance than you would expect them to be able to and not really be fazed by it. So they can have 5-6 drinks and seem fine, or they can smoke weed very frequently and not really seem high to you. The second sign is that it's stirring up some trouble for them, but they're continuing to do it anyway. And the third is that they're just not connected in the way that they used to be. Not connected to work, they're not connected to friends, they're not connected to family. So I'm going to connect these 3 telltale signs to what we consider to be some of the criteria we use to diagnose a severe substance use disorder. A severe substance use disorder is what we more commonly refer to as addiction. First, let me just take a step back and talk about what addiction is. At the core of addiction is an inability to control one's use of alcohol or other substances. And the way that this appears or shows up for different people can appear very different from one person to another. So we have a set of symptoms that we use to diagnose a substance use disorder, but not everyone with a substance use disorder has the same combination of symptoms. You can have as few as 2 symptoms and still have a mild diagnosable substance use disorder. That's not what we necessarily would call an addiction, but there would be cause for concern about somebody you love or care about, even with a mild substance use disorder, because that has the potential to progress into a severe substance use disorder or addiction. And that potentially would be more difficult to treat than something that's on the mild spectrum. That's more of a set of warning signals that a person could develop an addiction. So let's talk about symptom number 1. Symptom number 1 that I mentioned is when somebody can take more of a substance than you might expect and seem relatively unfazed by it. Most people whom I have worked with who do struggle with addiction, this is one of their first signs, and this is why I called it a telltale sign, is that if you used to be able to drink 2 drinks and feel a buzz or feel intoxicated, now you have to drink 4, 5, or 6 in order to get the same effect. That's the body and brain sort of adapting to the presence of the substance, where the body requires more and more of it in order to feel the same way that it used to. And it's when you start to escalate use in these ways that you may start to experience complications of using a substance, health complications, psychiatric complications, physical complications. And those are some of the types of problems that can lead a person to have a diagnosable substance use disorder. The second telltale sign that I mentioned is when your loved one's use of a substance is starting to stir up trouble. So what do I mean by that? One way that substance use can stir up trouble is when people start to lose their inhibitions when they're under the influence of a substance like alcohol, weed, or stimulants, opioids. They start to lose their better reasoning and judgment, and they may engage in some behaviors that are considered to be risky. So one very frequently observed example is driving while under the influence of a substance. So a person gets arrested or they get a DUI, they have legal difficulties, financial difficulties, but yet they return to substance use anyway. Some of the other types of problems that substance use can stir up that is not uncommon is behavioral problems and relationship issues. So you drink or use substances in such a way that maybe you become argumentative or angry, or you're passing out at a party. Maybe that's embarrassing to your significant other. Maybe this causes arguments between you and your family member. And yet, even though it's stirring up these troubles in relationships or in overall functioning, the person is continuing to drink or use substances anyway. So that is a little bit of a signal that the person has lost control in some form over their alcohol or their drug use. A third way that substance use can stir up trouble is what we call sort of social problems. Not so much in the way that you socialize with other people, but in terms of a person's overall role in society. So each of us have lots of different roles. Maybe your friend or loved one who you're concerned about is a parent, or maybe they're a career-driven person. So finding that they're not really functioning socially in many of those roles in the way that they normally would show up for them. So maybe late to work because of hangovers, or not showing up to work, or the quality of their work is not so good. Maybe the quality of their relationships with their family are not as good because they seem checked out, either because they're intoxicated or high on a substance a lot of the time, or because they're recovering from the effects of the substance. Maybe a lot of hangovers leading them to sleep in a lot and not spend time with the family. So they're not functioning in the way that they normally do socially and societally, showing up for their roles. Now we're going to talk about telltale sign number 3, a lack of connectedness. And what I mean by that is that a person, maybe they stop showing up to a lot of things, because usually when a person becomes addicted to a substance, the substance starts to take over or trump other things in their life because they've developed this dependency on it. So they're very preoccupied with when's going to be my next drink. How am I going to acquire more pills if it's an opioid addiction? And that sort of starts to take over and trump all these other things that used to be important and front and central in their life. And that's how they end up getting disconnected from other people. And so when that starts to happen, you start to notice like this person seems distant. They're not showing up for things as much, or maybe they are showing up, but they seem really checked out and not really like themselves. When somebody is truly addicted to something and they're going through these sort of cycles of use and withdrawal, they really may not seem like themselves when they're going through one of those cycles. So if they're in some form of mild withdrawal in between uses of alcohol, in between uses of opioids, they're not going to be feeling very well. They might be shaky, they might be anxious, they might be preoccupied with cravings or thinking about the next time that they're going to drink or use substances. And so even if they're showing up to things, you might just not feel that same connection to them, because it's almost like their relationship with the substance has taken over and become more front and center in sort of presence than their relationship with you. So those are the 3 telltale signs. Are they always apparent in someone? And how long does it take for someone to have an addiction spiral out of control in such a way that they need treatment? The answer is there is no answer to that. It's really different for each individual. Some people can kind of lope along with a low level of a substance use disorder, a mild substance use disorder, where they're experiencing some problems, but they're able to function through it. And it can take many years before that progresses to a point where it's really obvious to someone else who loves them. Other people will progress more rapidly and will really need some form of intervention in ways that are very obvious from the way that they're functioning or not able to perform at work or in their family life or other important roles. But it's really never too early to do something to intervene and to be helpful. We know that we have many effective treatments that are underused, both psychotherapy and medications, and the combination of the two. And people just don't access them frequently enough. So in my next podcast episode, I'm going to talk about what you can do and how you talk to somebody who may be struggling with an addiction and maybe doesn't know it, who you may be tiptoeing around and haven't brought it up yet, but you'd really like to see something change. There is an art and a science to having some of those conversations in ways that don't completely blow up. And I'm going to review some of those with you to give you the confidence that you can talk about this very highly stigmatized topic that people tend to shy away from, when actually you might be able to help them much sooner than you think. So thank you so much for tuning in. I look forward to seeing you next time.